And happy Wednesday to everybody. Good morning, Amy Taylor.
Good morning to you, Mom.
Good to have you here today.
Thank you very much. You have a spring concert today in this horrible weather.
Yeah, I'm keeping my fingers crossed. It's supposed to be at 1 o'clock this afternoon. If it's going to be so rainy that they're going to cancel it, I guess parents are supposed to know, a couple hours in advance. So I just checked with our weather guys. Like, what's the deal? 1 o'clock? Is it going to be rainy?
Yeah, you're not singing, just so everyone knows.
Thank you. Yes. Speaking of singing, do you hear a lot of snoring at your house? Are you a snorer?
I actually have been caught snoring because I have a lot of sinus issues going on right now. But my husband, if I said, well, I love you, honey, because I know he's watching right now, but
hi, Jason.
Freight train.
Oh, no.
I mean, and it's so deep that I'm going like this and shaking, and I've even hit him.
Like,
I have. Well, I've hit him. I've hit him really hard to try to get him to wake up.
If he sleeps on his side, does it go away, or does that not help?
No, nothing helps at all.
Nothing helps. Just a pillow in the face?
Yeah, I'll tell him to try to turn over, and then that'll wake him up and interrupt it, but yeah.
Yeah, we're going to get some expert tips if you've got some snoring going on at your house. So if you know someone, if you are living with someone who snores, oh yeah, that's my house. They got a picture of my bedroom.
Yes, the gap mouth. We know that look. Yeah.
I'm so mad at you because I'm not sleeping. Yeah. You may be experiencing some frustration and some sleepless nights too, but did you know that snoring may be a sign of more serious issues like sleep apnea or other sleep disorders, conditions that can be very serious? Well, now there's a new procedure that helps reduce snoring and treat mild sleep apnea.
Which is great to hear. It's called the pillar procedure, and Dr. Madan Kandula is here from Advanced Ear, Nose, and Throat Specialist, or ADVENT. But before we talk about this procedure, Dr. Kandula, thank you for being with us, first of all.
Yeah.
And we should say that you are a board-certified ear, nose, and throat specialist,
Absolutely.
Right?
Yep.
And that's important because you want the very best care and credentials when you seek a doctor.
This is correct.
Yeah,
yep,
we were
correct.
talking about sinus problems. That can cause a lot of snoring, right?
Sure. Yeah, I mean, it's one of those things that as far as people who snore or have those tendencies, if you can't breathe through your nose or can't breathe through your nose well, those tendencies are going to be exacerbated. So, yeah, a lot of times when I'm seeing people, all the time when I'm seeing people, it's definitely important to see how the nose is working for them or against them.
Yeah.
And the average person then requires how much sleep? I think the average American gets, what, 6 hours?
6 hours. Yeah, I mean, so the average person gets 6 hours. It should be more in the 8 to even 9 hour range, which I don't think anybody gets
Does
nowadays.
anybody get that
No,
anymore?
not in this country. No.
No,
Well, and you have young children. Amy and I both have young children. You know how it is. It's hard to get that much sleep in a given night.
Absolutely.
What about when you're sleeping with someone who's snoring, especially if they're snoring like a freight train? What kind of issues does it cause that other person? Because we always focus on the person who's snoring, but there are issues for that other person too.
I mean, it affects the whole family. So not only is the person who's snoring, obviously they're asleep for most of that time period. The person who's next to them for a lot of times isn't asleep or is having a hard time going to sleep, and they've got somebody to point to blame for their sleep issues.
And they can be seriously losing some sleep, and probably deep sleep is like out if they're constantly being awakened by snoring.
Right. I mean,
that's true.
It's really. I think everybody's been awoken by somebody who snores. Now, if the person who's next to you every night is snoring, it creates a lot of issues. I mean, it breaks up marriages, breaks up relationships.
Are you serious?
Over something simple. Absolutely.
Right. And also there are serious health consequences to snoring. It's not just something that causes some tension in a marriage or the husband to go into the other room. And what are those health consequences?
Well, basically, everybody has something called sleep apnea, which is when you stop breathing snores. Not everybody who snores has sleep apnea, but it's oftentimes impossible to know whether you're which category you fall in. And so getting it checked out is the first step.
How do you do that?
Really, kind of what we were talking about before, seeing the specialist like myself, an otolaryngologist, an ear, nose, and throat specialist, is what I'd say be the first initial step. And then depending on what we are seeing based on your anatomy, sometimes people need to get a sleep study done, which is a test that checks to see if you're stopping breathing at night. Other people don't. Other people we can pretty well figure out what's happening just based on looking at them. But again, if it's going on, you may have no idea how severe the problem is.
A lot of people who've been diagnosed with sleep apnea, or if they know someone who has sleep apnea, they're familiar with what's called the CPAP machine or mask. That's a common treatment for sleep apnea. What if it's not quite that serious?
Yeah, if it's not quite that serious, really it gets down to either surgical procedures, and the pillar procedure is sort of a surgical procedure, but pretty low key, or a dental appliance like a retainer that you'd wear when you're sleeping at night. But the good thing nowadays, we can help people at all degrees of the spectrum.
Well, what is the danger of sleep apnea before we move into the pillar procedure itself? But what is the real risk if you have it?
The real risk is the side effects. So one, you're tired all the time, which actually there's been a lot of studies looking at how many car accidents, things like that people get into. It's one side of things, but it also really ramps up your risk of heart attacks and strokes and things you don't even want to be going there. Because every time you're sleeping at night, when you're supposed to be sleeping and your body's supposed to be recuperating, you're shutting down. It's basically like somebody's coming in and strangling you when you're sleeping at night. Which is not a good thing, obviously.
And not very comfortable either. So let's talk about the pillar procedure. This is new?
Yeah, relatively new. I've been doing it for, I guess, a couple years now, but it's relatively new as far as treatments for snoring and sleep apnea goes.
Okay, and how does it work?
Well, what we're doing with the pillar procedure is we literally implant 3 little implants. So they're woven, basically suture material that's woven together that we place in the palate, which is the area just above the little punching bag in the back of the throat. So we put those in just in the office. Not a big deal at all.
Okay. And what's the difference then between this and something else? What was the alternative before the pillar procedure?
Before the pillar procedure, and even nowadays for somebody who's got more severe sleep apnea, sometimes we have to remove tissue in the back of the throat, which, like taking your tonsils out, we need to do it. It needs to happen in certain instances, but it's not fun. I mean, what you end up having is a raw area back there that needs to heal up. And, if you're not in that severe of a category, we didn't have a good option for you. Now we've got that in-between fit.
Are there fewer complications with that procedure then than like removing tissue or tonsils, things like that?
Yeah, it's really, we don't burn any bridges with it. The implants, we typically leave them in and they're there with you for the rest of your life. If we need to take them out, we can take them out. The only possible complication really that comes down to it would be one of the implants coming out, which is actually not a big deal.
It seems like there's a great trend in medicine these days to take the conservative approach first, to do things that are the most minimally invasive, and then move on to things that are a little bit more serious or a bigger step later on. You're going to actually be talking about the pillar procedure coming up on June 10th, right? Okay.
Exactly.
And this is a talk at 6:30. Again, it's on June 10th at the Crown Plaza Hotel, and I know you're asking people to just make reservations. It is free. Call the number on your screen if you'd like to attend and ask some questions of the experts. The phone number is 414-771-6780, and that's an opportunity for people to talk about their specific situation and get some ideas on how you can help, right?
Exactly. Yep.
Great.
You got it.
Wonderful. And if people want to get a hold of you at your office, there's the number you can call for Advent. They're located in Wauwatosa on Mayfair Road, and the phone number 414-771-6780. Dr. Kandula, always nice to see you.
Always
Thanks
nice to be here. Thank you.
Thank you, Dr.
Thank you.
Kandula. It's startling to hear that every 19 minutes a man dies from prostate cancer. When we come back, we'll tell you about the latest treatment options.